You are welcome to online lectures with Fraternity the Schoolboy. Today we are going to take a look at principles of pharmacy technician practice, and we have a question on the board. The question says, a patient asked a pharmacy technician if it is okay to drink grapefruit juice every day while taking Warfarin tablets. The pharmacy technician should A. Tell the patient that grapefruit is contraindicated while taking Coumadin. B. Tell the patient that grapefruit is okay. C. Refer the patient to a pharmacist. D. Tell the patient to call his doctor. Let's go back to the question. If you take a very good look at this question, two things are involved here. The first part of the question is about the drug-food interaction between warfarin and grapefruits and the role of a pharmacy technician. Now, let's talk about the first part of the question. I want to say one or two things on the drug-food interaction between warfarin and grapefruit. Actually, warfarin is an anticoagulant. It's used in some patients, that have issues with blood clotting, abnormal blood clotting. Yes, blood should clot, but when it becomes abnormal, is a problem. It can lead to a lot of complications, ranging from, when the blood clots, that clots in the vessels, especially deep vessels, deep veins, that clot can break away. Some may leave that place and go to other parts of the body and block the vessels there. If the clot blocks the vessels that supply the heart, it can lead to heart attack. So a lot of complications. So to avoid such, even pulmonary embolism, it can cause pulmonary embolism, deep vein thrombosis. Let us not go there. I don't want, that is a topic for another day. I just want to say one or two things about this. Now, actually, what happens is that when a patient is placed on this warfarin is also known as blood thinner. It takes care of this abnormal clotting, abnormal coagulation. Now, but it needs to be monitored too. Yes, because if it is not monitored, it can lead to excess bleeding, because the blood will become too thin. Then it can lead to excess bleeding. So clotting will become an issue again. So because of that, it needs to be monitored. For a patient to be placed on this warfarin, there's this test they carry out. We have PT/INR. We also have PTT. PTT means partial thromboplastin time, while PT means prothrombin time. And this means international normalized ratio. Now, this international normalized ratio is derived from what? The PT. Now, what is PT? PT talks about, it helps us to determine how fast someone's blood can clot. So if someone's PT is high, that means it takes time for the person's blood to do what? Clot. And if it takes too high, if somebody's blood takes time, very long time to clot, is a problem. The person can bleed to death. Any small injury can lead to excess bleeding. The same way, if the PT is very, very low, if PT time is very, very fast to clot, there's also a problem. Most of the patients that are placed on the warfarin normally have very low PT. But PT is not enough. The standard use is INR. INR is just a ratio of the patient's PT to a controlled PT developed by the World Health. There's a standardized controlled PT developed by the World Health Organization. So they now find the ratio of the patient's PT and that's controlled PT. So INR is what? Patient's PT over controlled PT. So this is how they get the INR. And INR has a range. A patient that has normal clotting is expected to be in this range 0.8 to 1.1. But a patient that is already on therapy, on warfarin therapy, they use the PTT to check the progression, how the treatment is going, the patient's response to the what? Treatment. That's what they basically use PTT for. Alright. Now, for a patient that is already on warfarin therapy, is expected the target INR for such patient is within the range from 2.0 to 3.0. That is the target INR we want to achieve. Now, for a patient that has a very high PTT, maybe 4.5 or let's say 4.5, 4 above, very high INR in this above 4 point something, 4.5, above 4 point, there's a problem. What it means is that this patient will bleed. So when a patient is placed on warfarin, there is high risk of tilting towards increasing this, going beyond this range. So if it's not well controlled, well monitored, it can go beyond this 3.0, 4 point and above. And the patient will bleed because the warfarin will keep preventing coagulation. That's the meaning. So the patient will bleed, can even bleed to death. So it needs to be monitored so that you know when to reduce the dose of warfarin, know when to increase, so that everything will fall within this range. Now, for a patient, when did you now start place a patient on this warfarin treatment? Is it when it is above there? No. Because below 0.8 means that the patient has a very low what? PT. And the ratio of this patient PT to control PT will also be low. And if it's fall below this 0.8, what means that the patient will have an abnormal clotting. And if care is not taken, cerebrovascular accident, what is it called again? Even deep vein thrombosis, pulmonary embolism, all those things can ensue because the clot will break and keep spreading to other flowing vessels and be blocking important vessels in the patient. So such patient, if it's fall below this, should be placed on warfarin therapy. Now, this is what happens. This is the relationship between warfarin and coagulation. Now let me now go to grapefruit juice. When a patient that is on this warfarin therapy and is taking grapefruit juice, what will happen is this. This grapefruit has the potential of increasing this anticoagulant effect of warfarin. beyond the needed level. So care should be taken. A patient that is under warfarin therapy should not be using grapefruit juice. And how does it do that? How does grapefruit do that? Grapefruit interact with the metabolism of this warfarin. There are some enzymes that are responsible for the metabolism of warfarin. So this grapefruit will go and inhibit those enzymes. So the warfarin will not be metabolized. There will be excess potentiated activity of warfarin. It will not be metabolized and leave the system. So warfarin will be there working. So the effect will be increased. It can lead that means it will increase the what? INR beyond this limit. So it's a problem. So a patient that is under warfarin, I don't want to go into the pharmacokinetics of talking about the cytochrome P450 enzyme and the isozymes 1A2 and I don't want to go into that. Let me stop at this level. That's another topic for another day. So I wouldn't waste too much time trying to talk about this. But just know, I wanted to know that what actually happens is that this grapefruit juice inhibits the metabolizing and the enzyme that metabolizes the warfarin, thereby increasing the activity of warfarin, thereby increasing the what? INR. So there will be clotting will be delayed. So that's what actually happens. So such patient should not use it. Should not use warfarin and the grapefruit juice together. Now that's about the interaction. Have you now seen why this is so deep for a pharmacy technician to handle? So a pharmacy technician is not expected, because apart from that, there are other things that may be happening with the patient. He or she, the pharmacy technician may not know. So it's not enough. It's not the role of pharmacy technician to sit the patient down and start talking about the interactions. No. The best thing is to refer the patient to a pharmacist, because he's there. There's a pharmacist there. The pharmacy technician is assisting. So the best thing is to refer the patient to the pharmacist and focus on the core pharmacy technician role, duties. So let's look at the options. Tell the patient that the grapefruit is contraindicated. No, that is not expected of a pharmacy technician. No, you don't do that. Pharmacy technician should not do that. There are other things, other technical work you should be doing there, rather than sitting a patient down and be talking about drug interaction. No, that is not the role of a pharmacy technician. Now, B, tell the patient that the grapefruit is okay. This one is even the worst. You not see why you don't, because some people make mistake and start saying what they don't know. Because it's by virtue of your training, you're not expected to go into pharmacokinetic profile of these drugs and the interaction. No. C, refer the patient to a pharmacist. Refer the patient to a pharmacist. Yes, the right thing to do is to refer the patient to a pharmacist. So the pharmacy technician should refer the patient to a pharmacist. Let's look at the other one, the last option. Tell the patient to call his doctor. The doctor has no business with drug-food interaction. No, that is purely pharmacist jurisdiction. So that is not the duty of a doctor. So this is what's wrong. The correct option is C, refer the patient to a pharmacist. Actually, I'm not supposed to start going deep into this, but I don't know who will watch this video tomorrow. That's why I say one or two things. Even though it's not the duty of a pharmacy technician to do this, but sometimes a pharmacy technician may be in a place. In reality, ideally, a pharmacy technician should not do this, but in reality, a pharmacy technician may be in a place where there is no pharmacist to talk to. what do? Do you tell the patient to go? Do you tell the patient to go look for a pharmacist? So that's why I decided to say one or two things here, so that having the knowledge, the world has changed, because in the palm of your hands you can get any information you are looking for. That's why I dished out this information. So if a pharmacy technician has the knowledge of this, it's not a waste. It's even a kudos, a plus to the profession. Yes, but not to be handling serious issues, but at least having an idea of what it can lead to. What may happen if you take these two things together. I don't think there's anything wrong there. That's why I'm doing this. But by rule, by ethics, when a pharmacy technician is working under a pharmacy where there's a pharmacist, you don't handle such. You refer to a pharmacist. All right. Thank you very much for your attention. Please, if you have any question, feel free to chat me up. My WhatsApp line is on the screen. Please follow my page and like my page on Facebook. My page name is Fraternity the Schoolboy. You can also subscribe. Please subscribe to my YouTube channel. My YouTube channel name is also Fraternity the Schoolboy. It's on the screen. There's something I organize every month. I tagged it Academic Battle with Fraternity the Schoolboy. It's an academic competition. My reason for doing this is to help our young ones, is to help our students, is to help our children develop this reading culture, develop this study culture, improving their academic performance. So I want to encourage you, every student, to participate in this competition. There are prizes to be won. It's absolutely free of charge. You don't need to pay anything for registration. Registration is free. If you are interested, chat me up on WhatsApp. I will send you the link for registration. We also need sponsors for this, because prizes are to be given to the winners, and they don't pay for registration. So that is the only way we can get money to give out to the winners as prizes. So if you are interested in sponsoring this, please chat me up on WhatsApp. I will send you account details where you can make transfer. Any amount of money you donate will go a long way motivating our youths to pursue academic excellence. Please watch my lecture videos on Facebook, on YouTube, TikTok. Watch them, share, like, share with your friends, share with your colleagues, share with your children, share with your students. Someone out there may need these lectures. God bless you. See you next time.